Hello, ladies. Thank you so much for tuning in today. This is going to be a great One Simple Step podcast today. The purpose of this is to empower women so that they can take the steps to healing and wholeness. So today, our topic is, what is a doula? How can a doula help me? Do I need a doula in my pregnancy or delivery? And today, I love having my guest, Tiffany Hardegree. What tips do you share with your pregnant moms to manage pain?
Okay. How much time do we have?
I know. I'm like, this is the good stuff. Like, how can we manage the pain?
Okay. So, move
Yes.
your body. Don't
Yes.
stay in the bed. And don't be afraid to try a position again. So, early in the labor, you might find it really uncomfortable to be on all fours, but maybe a little bit later, you find that really you find a lot of relief in that.
Okay.
So don't be afraid to try different positions and go back to positions that may not have worked before. And then I have my trusty. What I love is what's called a rebozo, and I actually have it here. A rebozo is basically...
Oops, I can't hear you very well.
So sorry.
That's okay.
Got a little too excited with my rebozo.
I know.
It is literally one of my favorite things. So It is basically a giant scarf.
Okay.
Okay. What's great about the rebozo is that the spouse and I can work together in supporting mom with this. So what you do is you take the wrap and you wrap it around mom's belly. And you can use it to do some hip squeezing. It's really easy. During contraction, the wrap is around the belly, and this partner has one side, I have the other. Of course, you can do it by yourself. It just gets exhausting. And you pull during the contraction. During that hip squeezing provides so much relief. I think women are so surprised when they look at me like, what am I going to do with a scarf in delivery, right?
Yeah.
And then when I wrap it on, they're like, oh, that's so nice. It's just such relief.
So it's going around once or
it's going
like
around
a
once.
U? Okay.
It's going around the whole belly flat like this.
Okay.
And then I don't think I can do it like this. And then you're bunching it at the sides.
Yes.
And literally like pulling it like a knot.
Oh, wow. Interesting.
And so then it's doing the hip squeezing here.
Yes.
And also you can use it for sifting to get the baby in their optimal position for a delivery.
Wow.
You can do it for belly lifting, because just lifting that weight is such a relief.
Yes.
Loads of different things you can do with this. And what I love about
is this something that you practice with them before delivery, or do you just do it? Okay. So that's okay. Wonderful.
We practice. So we get on the birth ball. Birth ball is a great place to do it. I love a good birth ball. And you can put the wrap on and do counter pressure at the same time. So again, that's why it's helpful to have extra hands.
Yes.
Because, one of the first times I used the rebozo, Dr. Ferguson came in, and I was over the patient. The patient's on all fours, right? Which can be a really nice position to be in all fours. I've got the wrap. I'm lifting the belly with the wrap, and this partner is doing the counter pressure in the lower back. So I have 2 tennis balls and a sock. Very easy tool to have for counter pressure. And you apply the counter pressure in the lower back, just where that divot is in the lower back. And during a contraction. So I'm standing over her lifting, and the spouse is doing the counter pressure. She couldn't believe it. She made it all the way to 10 centimeters in that position. And she had, this was her second delivery. She had planned to have an epidural, but she didn't need it. She made it all the way and had a natural delivery unexpectedly because the rebozo and the counter pressure and, of course, my oils all worked well together. Yes. So you just never know what's going to work. And some people hate the rebozo. Some people don't love it. So it's just being open to trying different things. Right. I also find water to be very helpful for pain relief. So whether that is being in a tub or in a shower, both can be helpful for pain relief, especially if you already find relaxation or being in water relaxing already. Then doing that during labor and delivery. Water birth is an amazing, beautiful thing. The pain relief is similar to that you would experience to an epidural. So if you want to have a natural delivery without an epidural, but you're getting to this point where you're feeling like, I don't know if I can do this,
Mm-hmm.
I always suggest water. Let's take a shower, or if possible, you can get a big tub that's
Mm-hmm.
put in your room. Ours here are inflatable. You just blow it up,
Uh-huh.
put warm water in, and then you're in, and that can provide such relief there.
That's
And you
great.
can still do counter pressure while you're in the water as well. So you're
Uh-huh.
doing your counter pressure, you're doing your breathing, you've got your water helping. I mean, it can be so many
Wow.
different things.
That's
Yeah.
great. Where do we go from here? I mean, I've got so many other questions. Like, should we go to more pushing tips? What are some pushing cues, or how do you help women through that?
Yeah. So I get a question a lot with, how should I be breathing?
Mm-hmm.
Right? How
Mm-hmm.
should I be breathing for pushing? And there's a lot of education out there with breathing. And we specifically don't educate on breathing. We
Okay.
feel like you've been breathing your whole life, you
Uh-huh.
pretty much know how to breathe, right?
Uh-huh.
But I do cover a couple of things especially with pushing, right?
Okay.
So when you're pushing, you want to push in a position that is comfortable to you. And
Mm-hmm.
I like to remind women that when you're at 10 centimeters, you have some time. So you can try different positions to see what feels good, what
Uh-huh.
feels empowering, like you have a good grasp on the pushing. There's some practice pushings before, like the final, you can't
Yes.
move anymore, you're in this position, right? So a squatting stool can be very helpful.
Uh-huh.
Squatting stool looks like a U,
Mm-hmm.
and you can put your feet up on the edge of the U, and then
Uh-huh.
have a nice squat position that can be really helpful for using gravity, as well as having a good strength in that position.
Uh-huh.
You can find much strength in that position. Sometimes women, of course, they say don't want to push on your back, right?
Mm-hmm.
It's hard to get power if you're lying on your back.
Right. Mm-hmm.
But again, some women love it. So
Uh-huh.
that's why I say don't rule anything out. Try everything.
Right.
There's also a bar that can be put on the bed
Mm-hmm.
of the hospital bed that can be used as a squatting bar. So you can
Oh,
use
okay.
squatting. All fours is another great position where you're on
Right.
all fours and pushing that way. And oftentimes with pushing, so it really depends. Like if a woman is doing hypnobirthing, for example,
Mm-hmm.
they're doing meditation, I'm not going to be coaching them in their breathing or in their pushing. They're going to be
Mm-hmm.
really listening to their body and digging in, and I'm more guarding the space.
Right.
If
Right.
you're not doing hypnobirthing, what you want to do during a contraction, typically you can get 3 good pushes in
Okay.
during one contraction.
Mm-hmm.
And you can usually, we try to hold out for like 10 seconds, like
Mm-hmm.
hold out for 10 seconds to do one strong push. And the way I like to illustrate it for women, you want to quickly change out the breath
Okay.
and push again, because when you're pushing, your baby's starting to move down.
Mm-hmm.
When you breathe in, the baby comes back.
Right.
So if you can build on the momentum of your first push,
Yes.
then you're going to get the baby to move further, right?
Beautiful.
So that's why you quickly change out the breath in the pushing. So you're pushing down,
Uh-huh.
and then go again,
Uh-huh.
and then go again, just for 3 times, and only pushing during the contraction. After the contraction, you're breathing in through your nose. Want to remember, when you're breathing in between and you're breathing in labor, you're breathing for your baby. So you want to
Mm-hmm.
breathe in through the nose. That's going to help bring oxygen to the baby.
Mm-hmm.
Because your baby's experiencing the contractions as well. So the
Right.
heart rate,
Right.
jumps around. And so when you're breathing in through your nose very slowly and controlled, and blowing out through your mouth in between contractions. And even before the pushing stage, that's the way that we want to focus on breathing. We want to breathe in slow, controlled. That's going to help release tension in your body. And as women are doing that during contraction, I try to help them count to 10, breathing in and
Mm-hmm.
blowing out, counting to 10.
Excellent.
And as they're blowing out, I want you to visualize releasing the tension in your body.
Yes.
So there might be a specific part of her body where I can see the tension.
Right.
So I just gently touch that part of the body.
Uh-huh.
And I say, and I've talked to them before. So I was like, if I put my hand somewhere, that means release that tension, right?
Yeah.
If that little cue doesn't work, then I say, as you're blowing out, release the tension in your shoulders, all the way down your arms, through your fingertips.
Mm-hmm.
And then at the next breath, we're releasing the tension from our neck, down our spine, all the way through down our legs to the tips of our toes, and we're releasing that tension. So as you're blowing out, that's kind of what you want to visualize, is really kind of letting go of the tension in your body. And then I think the most important part in pushing is when the baby starts to crown, when the baby's really getting ready to come out, you want to stop pushing. Because you want to allow time for stretching, right? Yes. You want to allow time for the perineum to stretch. You want to, but it can feel like you want to just hurry up and get it over with.
Yes, I remember that pressure.
Yes, yeah, that pressure, they refer to it as the ring of fire, right?
Yes.
And you don't want to push, like bear down and just push through that, because then you're going to have a tear, right? So what we do for that is, people laugh at me when I tell them this, but during this moment, to relax the muscles there,
that's great.
Sounds silly, but when you do that, you can't push, and it also relaxes your muscles there.
Beautiful.
So there's that, or of course, you'll hear often pant like a dog. Quick, short breaths, breaths. That you can't push through as well. So then once you're through, you've allowed that time for stretching. The doctors that I work with are really great about coaching in this part. And then you can do your final push to get the baby out. So I kind of touched on a ton of things there. I hope I wasn't too all over the place.
No, I think that was wonderful. A lot of the breathing, the positions, all those things play in. We didn't talk about the perineal massage, because a lot of times the research is out there, start about 34, 35 weeks, start stretching that area, because again, lots of women are asking me, how do I prevent a tear? And as a pelvic floor physical therapist, we're like, okay, let's stretch it and let's work on lengthening it. Let's really open up this area. So what would you say about the perineal massage and those types?
Yeah, so the research on this is, again, I got it from an evidence-based birth. So the research is a little confusing. So it's most effective for first-time moms. And it can actually, you can do it too much where it's no longer helpful. So you don't want to do it too much. And again, only helpful for first-time moms. So and again, depending on where you're from, people are really passionate about this. But it's not something that I teach my clients to do, because they could get too carried away with it, and then it can be not super helpful. What's more important to focus on is, in my opinion, this is just my opinion, is decreasing the risk of the rate of episiotomy, right? And depending on where you are in the world, episiotomies can be very routine. And the way you can decrease, the most decreased risk to the perineum is going to be without the episiotomy, and allowing that natural, if it were to tear, natural tear. And again, in pushing, you're going to be doing really controlled pushing, especially at that stage where they're crowning, right? So that you allow that time for stretching. Our doctors here will massage during that time. Will massage that perineum. So you can ask your doctor, when I'm pushing, will you massage the perineum, and will you coach me and let me know when I should allow time for stretching? Instead of just, pushing through it.
Let's explain where that is in the anatomy, the perineum. So we're talking at the vaginal opening here, and then the anus or the rectal opening is down here. So that area in between, so it's really stretching this area towards the bottom area, not towards your nose.
Yes.
So, just to clarify that one.
Yes, of course. Exactly. Unless you're in this birth world, you probably don't use the word perineum very often.
Yes.
Yeah. And sometimes, did you want to see the illustration with the episiotomy?
Sure, let's go ahead.
Here? So I like to explain it this way with the episiotomy. If you were to have a piece of paper and you were to cut it with scissors, so that would be like an episiotomy. Right. Which is,
I had, because that was 13 and 11 years ago in the US. So I just thought, I get an episiotomy because it will direct the tear. That was the research 13 years ago.
Yeah.
Now it's changed a lot.
Now it's changed, and we can see why here. So it's a clean cut here, right? There's nothing in between. And then if you were to tear the paper, then you can see, I'm not sure how well you can see. You can see the little fibers between. So those fibers are going to help you in the healing process, right?
Right.
Here, they've got to find their way back completely. You've got to do stitches, and it's going to take longer to heal that
Right.
episiotomy. With the natural tear, there's the little fibers in between that are going to come back together easier.
Yes.
It's going to be easier to heal a tear.
Yes. Yeah. And it's great because the episiotomy rate now in the U.S., I think, is between 1% and 2%. But you were saying in Europe is quite high.
Yes.
And you actually have women that come in still and ask you, being in another country, to have an episiotomy. So
yeah, for sure. And that illustration, I think, makes it come to light for everybody. Like, oh, that does make sense. Like, you don't want to just routinely, and oftentimes, again, if you're doing the controlled pushing, you oftentimes won't have a tear.
Right. Right.
Or it'll be very minor.
Yeah. Even the grade 1 is just a laceration. It's very, very mild. So
yes. Yeah. It's not often, unless you're using forceps or something like that, where it's going to more invasive, traumatic, then you're not going to, I think people are just fearful they're going to completely tear open.
Right.
And the tear isn't, there's different degrees of them.
Right.
Sometimes you don't even see them, or sometimes you don't even need stitches for them.
Right.
So, yeah.
And then there's things that you can do afterwards, some of the scar tissue, seeing a physical therapist. I mean, you don't have to do this all on your own.
Afterwards, I think the biggest thing that we're lacking in the U.S. is support afterwards.
Yes.
We need rehab for our pelvic floors after delivery. Like we need to go see someone to teach us about our pelvic floor and how to strengthen those muscles after delivery. That is something, again, we just don't know about in the U.S. No. But in Europe, that's a standard practice.
I think you go to your doctor as a 6-week follow-up, and then you go see your pelvic floor physical therapist, and you have to be cleared.
Yes.
Like, okay. Yes.
Exactly.
I know. And I wish I've been doing this for 20 years. I'm like, and we've come a long ways, but we have so much farther to come. So
yes. Yeah. So definitely afterwards, you want to get support from a pelvic floor specialist.
And not just for vaginal deliveries, even C-section too, because you have that scar tissue. And a lot of women say, well, I won't have pain with sex because I have a C-section when I return. Well, that's still, the pelvic floor has still been affected as well. So it's like, we just, more education and more help, because again, women, we don't have to do this alone. That's the thing too. Like, get a good team around you through the pregnancy, during the delivery, and for postpartum too. It's just, it's wonderful. We've got lots of resources. We just got to know what they are and how to tap into them.
Absolutely.
Definitely. Tell me about essential oils and how you use those in delivery. In fact, today I had just posted about using essential oils, and of course someone said, oh, I'm so scared about using oils. And it's true. You definitely have to know how to use them correctly, know what's safe in pregnancy, might be different in delivery, might be different for breastfeeding. So there's a lot of information, and it can be very overwhelming, because I remember when I started using oils, it was like, and now I'm like, oh, no, we can do this. So tell me a little bit about your experiences.
So number one, you want to make sure that you're using pure, safe, essential oils. That's the number one. And I have not, so I feel comfortable sharing essential oils with my clients because I use doTERRA certified pure therapeutic grade essential oils. So they do not compromise on quality. They undergo loads of testing, and the test results are published. So I trust the quality for sure. Anytime, but especially during pregnancy, labor, delivery, you want to use them. You want to make sure you're using quality essential oils. So I use, obviously, I'm very passionate about oils. I use them with everything within pregnancy. Definitely in pregnancy and leading up to the delivery, because there can be so much fear. Using essential oils to help with that anxiety and fear leading up to the delivery is going to be really helpful for having a more successful delivery. So essential oils are really powerful in working with emotions, because when you inhale an essential oil, you have your olfactory nerve here above your nose. It goes through your limbic system to your brain. So that's why they can be very powerful for emotional support.
Yes.
So for pregnancy, I love to use them leading up to the delivery. For emotional support, to get rid of that anxiety, to get rid of that fear. And usually we cover this in our first prenatal appointment, and I know which scents you like and what you don't like, because also it matters,
Yes.
right? Which one you
Yes.
like.
Oh, yes.
Oh my gosh. Yeah.
It's one extreme or the other.
Exactly. So we will usually choose a blend for the delivery. And one of my go-to blend was Balance, which is a grounding blend made by doTERRA, and Wild Orange. So Wild Orange is very uplifting, and Balance is going to be helpful for grounding that anxiety, those emotions. So that when you go into delivery, you want to think about creating your safe space. You want to think about creating your nest, right? And so all the things that come with that, the lighting, the scent, the smell that's in the room, you can think about a smell, right? I'm sure you still remember
yes.
the kind of smells, right?
Yes,
Takes
yes.
you right back, right?
Right. They're
so
powerful.
You want to create, super powerful. So diffusing in the room, I like to diffuse to set up that space, and it really helps with all of the staff. When they come into the room, you can see, for them, it's also like, oh, and the doctor's like, oh, Tiffany's here. I can smell it. He's here. But actually more recently, I've been using a new blend by doTERRA. It's called Adaptive.
Oh, yes.
Oh, I love Adaptive.
Yes.
It is amazing. And it is a blend made specifically for anxiety, stress, and it's a beautiful mix of florals and citrus oils, and super uplifting. So, whichever one the client decides for diffusing in the room. And then I personally will spray that on myself as well, usually the Balance or Wild Orange. And then I always have peppermint in my pocket. Now, peppermint you want to be careful with in pregnancy. Sometimes, again, there's not a ton of research to support this, but in some cases it can reduce the amount of breast milk. So you don't want to use peppermint internally. You don't want to apply it on or around your breasts. But what's helpful for peppermint is during transition. So between 8 to 10 centimeters, when things are really gearing up, and it may be a moment where you're lacking energy, you're feeling a little discouraged, and peppermint's going to give you some energy. It's going to cool you down as well, because it's also the time that you get sweaty, right? Between 8 to 10 centimeters. So I apply the peppermint. Oops, I lost my earbuds. Apply the peppermint on the back of the neck, and I also have it in a spray bottle with some witch hazel. So I will spray it here on the neck and on the back of the neck, and that will help cool. Then you've got the aroma that's going to give you the energy, and you're ready to get to the pushing stage.
That's great.
So peppermint. What else do I use in delivery? Clary sage can be helpful for supporting contractions.
Yes.
So again, this one's only going to be used at 40 weeks when you're full term and ready to deliver. And there's different points on your feet that you can apply the oil that can be helpful for supporting contractions. And of course, I love to use the Aroma Touch the Massage blend to do some shoulder massage, some lower back massage. I'll stop there. Those are the top ones that I use.
That is great.
Yeah.
That is great. And then those are powerful too, because it takes you back to that special moment of delivery. So it becomes a very powerful scent for you and the baby later on.
Absolutely. And can I tell one story?
Yes, please. Okay. Tell me a story.
So I had one client, and this was I would say in the beginning of my doula career, and I was so excited to use my oils in the delivery. And this was her second delivery. She was very anxious. So I always used the Balance and Wild Orange blend for her for anxiety. But then during delivery, she clung to the Wild Orange. So much so that before she made any decision, she took a moment to inhale the Wild Orange.
Wow.
And during the pushing stage, I had her water in one hand and the Wild Orange bottle in the other. And literally between every push, she used she inhaled from the bottle, from the Wild Orange. And she was just like, where's the oil? And then she would inhale. She's like, okay, here we go. And then she would inhale, and I was blown away to see how helpful that oil was. So I gifted her the oil, of course. It's like, you have that.
Right.
This is for you. And it made such a difference because, and then I went and did some more research afterwards. Wild Orange is uplifting, but it can also help in decision making, which is super interesting.
Yeah.
And I saw that like true to my own eyes. Because again, sometimes I feel like, oh, that's silly. Like, how can an oil help with decision making? But to see it in action, she needed that oil. That is what got her through that
Yes.
delivery. It was
Yes.
amazing. Absolutely
Yes.
amazing.
Do you ever suggest that some of your women use the oils at the, say, the third trimester, to almost prepare them mentally to help them relax and replace or duplicate the delivery room as, say, at home with the same oils and scents? Have you ever used that? Or
Absolutely, absolutely. And again, I'm going to go to my Balance and Wild Orange. I put it in
yes,
a roller ball for my
yes,
clients. So you always want to dilute oils when you're using them in
yes,
pregnancy. And so I
with
dilute it
coconut
with,
oil.
yep, with coconut oil or almond oil, really
Mm-hmm,
any avocado oil, any oil.
uh-huh,
But I like coconut oil. It's really
mm-hmm,
good for your skin. And I just put it in a 10 ml roller,
right,
and I do about 8 to 10 drops of Balance Wild Orange, and then you fill the rest with coconut oil. And then you're going to roll that for emotional support. You want to roll on your wrists, you want to roll behind your ears, anywhere that you're going to smell it.
yes,
So you can also even put it on your clothes. And so that I have another client, the one that went to 10 centimeters unexpectedly with the wrap, and Balance and Wild Orange, she was totally obsessed with that in her pregnancy. And she has told the story, like, that is what got her through the whole delivery, was through pregnancy and the delivery. So she used it daily, several times a day leading up to it, because again, she was very anxious. Her second baby, she didn't have a great first experience. She was
right.
very anxious. And again, we had a beautiful, beautiful delivery. So yeah.
I love those stories.
Yeah.
Love those stories.
So good.
Ugh. So we've talked about this a little bit. Sometimes the mentality is a doula is just going to help me in labor and delivery, but it sounds like you are working with these women. How many times do you meet with them before delivery, and how does that? And do you ever see them postpartum?
Oh, great question. So there are, you have childbirth educators that can
Mm-hmm.
people that can be educated in childbirth, doing classes and everything.
Right.
And then you have your childbirth doula, whose main focus is the delivery, but you have to prepare for that, right?
Yes.
So typically we meet I like to meet twice. So the first one, and we can always do more. It really is different with every couple, whatever their needs are. But the package that I do includes 2 prenatal visits. The first one, we go through the process, all the nitty gritty. Like, what does this look like? When do I go to the hospital? Do I want the IV cannula or not? Do I, all the, don't say the word contraction. I hate that word. Don't touch me here. This is I don't like that. So we talk through all the likes, dislikes, the procedures. And then the second one, we do the practice where we practice different positions. I use the wrap. We, get the partner involved, and we practice the counter pressure, and we just have a lot of fun. I think, and I like to remind people, your birthing process should be fun. You can laugh in your birthing process. You can dance in your birthing process. It's okay. Like, whatever works for you,
Yes.
So then the doula's on call usually I'm on call 36 weeks to 42 weeks.
Okay.
So at any point when you go into labor, then I meet you at the hospital. Now in China, home births are illegal. So I can't meet a client at home, because if we were accidentally deliver the baby at home, that's a big risk for me.
Okay.
In the US, doulas often will go to your home and help you cope and help you decide when to go to the hospital.
That makes sense.
Okay. So I'm available, of course, 24/7 via phone, or in China, WeChat, calls, all the things. And then I meet you at the hospital when it's time to go to the hospital. And I'm there the duration. So it doesn't matter how long it is. Could be 36 hours, and I'm there the whole time. And then I typically stay between 1 to 2 hours after delivery, help with the first breastfeeding experience, help the baby latch a little bit. Now, I'm not an expert in breastfeeding. That will be the next certification that I get, because breastfeeding is such a challenging thing.
Yes.
You need so much support. I hate when people say, oh, it's a natural. You just put them on your, it's the most natural way to feed your baby. Put them on your breast. It is, sure, it's a natural bodily function, like that your breasts make milk, but it's not natural to feed your baby. It's a big learning curve. actually.
You're learning and the baby's learning. I mean, it's mutual.
Yeah. And so it's a huge, huge learning curve. So then I do one postpartum visit. And usually in that postpartum visit, I do go to their home because it's a little bit easier for them. And I might help with things like the first bath or talking through where to put the baby at nighttime, like their setup in the room and like all of those little things. And then we process the birth and talk about, things that happen in the birth if they, want to talk through. So that postpartum visit, again, looks different based on what every couple wants. But that's typically the childbirth doula role. Now, there are postpartum doulas that do all the things for newborns, right? They're going to help. They can come for extended periods of time, perhaps to help you with sleep training or help you with just give you support during that postpartum period. So that would be something different than the role of the childbirth doula. Yeah.
That makes sense. It's great seeing the whole picture there.
Yeah.
Wow. What else? Is there anything else that you want to share? I mean, you are a wealth of knowledge.
I guess the biggest thing to share is just don't be afraid to ask questions and ask until you understand. Mm-hmm. And if you don't understand, if they're using lingo that, is you don't understand because you've never had a baby before, then just keep asking.
Yes.
There's nothing wrong with asking questions until you understand. And birth is an amazing, incredible thing. Your body is so strong. You're so much stronger than you think that you are.
Yes.
And so much stronger. And it's amazing. So just make sure you have support and talk through what your desires and wishes are. And it can be a beautiful experience. It is a beautiful thing. Oh, I love it.
Wonderful. Oh, you've given me so much information and women, just power and calming down the fears and educating. I mean, this is just huge. And that's what One Simple Step is here for, is to help women, because there's healing and there's health to be achieved through whatever stage. But right now, as we're focusing through pregnancy and delivery, that's huge. So
can I do one more thing?
Yes.
I have one more thing.
Tell me.
Choosing a doula. How do you choose a doula?
Yes.
So I don't
now that you've convinced everybody, everybody's like, yes, I want a doula. Now where do I find it?
Yes. So
Tiffany's in China. I can't get hers.
Unfortunately, I'm in China. So if you know anyone in Shanghai, I'm here. But choosing a doula is very personal. Mm-hmm. So if you go into, don't be afraid to interview doulas. Don't be afraid to meet different doulas. Yes. And you want to find someone that you connect well with personally, that you feel safe with. So if you go in to meet a doula and they're going to, it feels like a drill sergeant and you don't feel super comfortable with that, that is okay. And that doesn't mean that all doulas are that way.
Right.
So take your time, interview the doula, ask them, questions. What's your opinion on this? Or how do you feel about epidurals? Or what do you see your role as in my birth? Those sorts of things. And make sure that you click. A lot of the support with the doula, a lot of the success of a doula is if you click personally.
Right. That makes sense. And did you say there's a website or somewhere where you can go? Or do you recommend just talking to your doctor and seeing if they have used other doulas in the past or in their clinic?
So you can often find there's birthing centers usually a lot in the U.S. And so you can do a quick Google search for birthing centers in the area, and they usually have doulas that they use. Again, there's so many ways in the U.S. I feel like there's different avenues for doulas. So ask around. There's Facebook groups. There's, just do a quick Google search for your area, and then you can usually find some doulas there.
That's wonderful. Yeah. Wonderful.
Okay. I'm really
any other? No. Either. Again, it's one simple step. So any last minute, one simple step that you would give to a pregnant woman?
Don't listen to everyone.
Oh, yes.
What works for you and works for your baby works for you. You're going to get way too much information. You're going to hear, I don't know why people feel entitled to have opinions for other people's pregnancies. And so my biggest advice is to silence the noise.
Yes.
To do your research. What works for you, take what works for you and leave the rest.
Wonderful.
And trust your gut. Trust your, what works for you works for your baby.
Wonderful.
There's no right way.
Yes. Wonderful. Well, thank you again, Tiffany. And again, ladies, thank you so much for listening in. And we could have some husbands and birth partners listening in also. And again, thank you so much. And I hope that this has been a great tool and so many tips have been offered today. And I hope that you feel empowered as you approach your amazing delivery and then you get to meet your dear baby. So have a great day. And again, thank you. And thank you, Tiffany, so much.
Of course. Thank you so much. Have a great day, guys.